Today we're going to discuss a topic which has been on every major news source in this country, universal health care. By definition, it's publicly funded medicine is a level of medical service paid wholly or in majority of public funds and is often referred to as socialized medicine. There are multiple reasons why socialized medicine is bad for the United States. First, there's overcrowded hospitals and clinics. Second, government rationing. And third, in socialized medicine, there's a delay in healthcare. The first topic is overcrowded hospitals and clinics. This equals overworked healthcare providers, tired doctors and nurses, and eventually results in unsafe, untrained practices. There's a burnout of staff and accidents happen because of poor care. The second thing is medical rationing. Sugar, butter, gasoline, and doctor's visits. What do they all have in common? Rationing. In World War II, sugar, butter, and gasoline was rationed by the government. Would you want your doctor's visits rationed in the same way? Under government rationing, doctors are given a budget assignment. The government does not claim all decisions are clinical, so therefore you may be discriminated against because of your age, your healthcare problems, and other factors that may not have anything to do with your the clinical findings. And the third is the delay in healthcare. Let me read this article to you about a girl who's 3. It was taken out of British Times in April 23rd, 2009. It says, girl 3 has heart operation canceled 3 times because of bed shortage. A 3-year-old girl awaiting heart surgery has had her operation canceled 3 times this month because of a shortage of beds. Ella Cottrell was due to have aorta widening surgery on Monday at the Children's Hospital, Bristol. But 48 hours beforehand, the operation was canceled for the 3rd time, as all 15 beds in the intensive care unit were occupied, her parents said. A hospital spokeswoman said that procedures would be reviewed, but the case highlights a growing problem of canceled operations in national health system. More than 57,000 surgeries were postponed for non-clinical reasons, including a lack of beds. Last year, 10% more than the previous year. Latest figures show that the problem persists. At least 43,000 operations were canceled in the first 9 months of 2008-2009, with nearly 1,800 patients not being treated within 28 days of their original scheduled date. Among the excuses for cancellations, the previous year were a hospital running out of shavers to prepare patients for surgery, a surgeon going missing following a fire alarm, and a patient's translator failing to turn up. Ella needed open heart surgery when she was 9 days old to repair her aorta, the body's main artery, which had not formed properly in the womb. At 18 months old, she suffered a stroke after falling down the stairs at her home and banging her head, temporarily paralyzing the left side of her body. Her parents, Ian Cottrell and Rachel Davis, were told in October that she would need an operation within 12 to 18 months. Doctors carried out 2 angioplasties, where small balloons are inserted and inflated into a clear blood vessel, but neither was successful. Further surgeries initially planned for April 2nd, but was canceled because of emergency cases and rearranged for 4 days later, the couple said. However, the operation was canceled again for the same reason. A 3rd date was arranged for April 20th, and last Thursday, Ella went to the hospital for tests. On Saturday, her parents received another call explaining her operation would have to be canceled. Ms. Davis, who works part-time as an accident and emergency nurse at the Franchise Hospital in Bristol, said that she was devastated when she was told there was not enough beds. The family are awaiting for another surgery date. In the meantime, Ella is having to take adult doses of medication to control her blood pressure. We have asked the doctors if she really needs the surgery, as she is so happy at the moment and is running around like a normal little girl. But she could drop dead at any moment, Miss Day says. Twice I have been told that she may not make it through the night, and there have been times when I have gone into her room in the morning and wondered whether she'd still be breathing. She called on the government to put more money into the national health system before a child died on the waiting list. I have worked in the NHS for 22 years, so I know what happens in hospitals, she said. I cannot fault the doctors and nurses for all they have done for Ella. She would not be alive today without them. I believe Ella is the tip of the iceberg, and there are many other families out there that have their operations canceled more times but have not spoken out about it. This is a national problem. There are not enough resources in the national health system, and it is about prioritizing. It is a matter of time before a child dies on the waiting list, and I don't want it to be Ella. If that happens, the government will have blood on their hands. Michelle Naray of the University Hospital Bristol National Health System Foundation Trust that she could not discuss individual cases. She added, the decision to cancel any patient for any procedure is taken extremely seriously, but it's sometimes unavoidable because of the need to effectively manage emergency patients requiring beds on a day-to-day basis. We know that canceling procedures can cause additional stress for patients, so we will always seek to avoid this whenever possible. That just reemphasizes the delay in healthcare when we read about that article, and that's happening in Great Britain. Also, the patients have to wait for specialists under this plan. 50% have to wait 1 month and 20% over 3 months, often complaining that they're in a lot of pain the whole time that they're waiting. In conclusion, do you want your doctor's freedoms to your care limited by budget? Do you want overcrowding in hospitals and emergency rooms and government rationing and control? Do you need the delays in healthcare? It doesn't sound very American to me. So you make the choice. Who do you want to take care of your health care? Do you want the government or the doctors to take care of you? Thanks.